I'm going to give it a few more minutes. I see a few people still coming in, and then we'll get started. Great. I'm going to go ahead and get started. I am going to record this, so for those of you guys that have registered, you guys can definitely access this again. We will also be putting it up onto our LibGuide, so you can go back and watch this recording. So today what we're going to be focusing on is how to write and publish case reports. My name is Leslie Golam. I am one of the library liaisons at the Mesa location. I do currently work with most of the ASHES programs and also our SOMA program. So if you have any questions in regards to this, you guys can definitely feel free to reach out to me. My email is listed here. So our objective today, we're going to be kind of talking about what is case reports. We're going to go through the process for case reports. We're going to kind of cover some types of case reports. We're going to talk about the care guidelines, and we're also going to talk about publishing. So the first thing we're going to look at is what is case reports. So case reports are very, very small. They're not your big, long research project like a symptomatic review, scoping review, or a lit search. You will do some lit searching on these case reports, but you're not doing a full in-depth one. A case report is a detailed report of symptoms, signs, diagnosis, treatment, and also follow-up of your individual patients. So just keep that in mind. Case reports usually describe an unusual or novel occurrence and remain one of the cornerstones of medical processes or progress and relevant research literature on that topic. Case reports is a rapid, short communication between busy clinicians who may not have time or resources to do a large scale report. So the types of case reports that usually come up are a typical presentation of a very rare condition. So like COVID, when that came out, it was very rare. So doing a case report outlining the presentation of the disease so rare that is unlikely to be good data describing the disease in large populations. The other one is an atypical presentation of a more common condition. So like our flu, it's more of a common condition, but the symptoms may change every year. So that may be a case report on the new changes, new imaging that can be used on that condition, new symptoms that may be coming up. This will help raise awareness for the range of presentation for this new condition, what is coming out. It could be that common condition may have new findings where you're doing new imaging, blood tests may be showing this symptoms now. So that's what the atypical one is. The next one is a rare sequence of a common condition. These case reports usually outline the presentation of a common disease or complication that are rarely seen in patients with that disorder. These describe events to educate clinicians to remain vigilant for these unusual conditions. So somebody may have one disorder and then you have somebody come in presenting different symptoms of the same disorder, but they are common. So hopefully that Makes sense. Also, the next one is a rare complication or intervention of a procedure. So this could be like new imaging, new technology that's coming out that you guys have found that would help. Maybe new technology or imaging that could help with warning signs of cancer, help to prevent similar complications in the future. So this can be a case report as well. Another type of case report is extremely odd or interesting events. So this type of case report outlines the expected presentation to bizarre, amazing, or often so rare that you usually add little to the clinical disclosure. So that's what the interesting ones are. So again, COVID is another one that could be added in here. Any of the new diseases that may be presenting itself, rare or odd, different cancers that may be coming out, or treatment that we may be finding that can help with that as well. So some of the steps to take when you are starting a case report is, first you want to obtain the consent from the patient. So you need to make sure you follow all the HIPAA laws, all the FERPA laws, and you need to provide that consent as well. Because when you go to publishing, they're going to ask that you have this, because when you are writing these case reports, you will need to have the patient's consent and letting them know, hey, we are using your information, we're using your test results, we're using your imaging, we're using all of your diagnostic stuff. So that's the first thing that you need to do, is attain consent for the patient. The next portion of writing the case report is the discussion. Discuss with treating the clients that are treating. You need to have that discussion with them. It's also a best practice that you reach as an author, that you should reach out to other professions who are providing the care for the patient. You need to let the professions know that you're considering writing a case report on this topic, so that way they are aware and they're not getting blindsided. The next portion of it is building your team. When you are building your team, you want to look at your colleagues, supporters who will assist you in writing the case. This can also include the experienced clinicians that are providing the treatment. You can ask them to come on board and help you to build your team. From there, you're going to be gathering your information to write your case report. So the team, to gather your information, you will have to require detailed accounts of the patient's presentation and the client's notes. So all of the notes that have been taken, diagnostics, like I was saying, going back to that consent, the diagnostics information, all your medical tests that you've ran, all of the diagnosis that you guys gone through, symptoms, all of that is what you'll need to gather. From there, you'll move on to the last step, where you perform a literature review. This is not a very extensive literature review. This is a very high level review, so you're not going very far in depth. When you perform a literature review, you'll need to focus on the disease itself. And you should also focus on a high quality primary sources. For a case report, you are looking at doing a abbreviated version. So basically, like I said, high level literature review, and it's not expected to include every relevant article. You're really focusing on the patient in their diagnosis, in their condition. So some of the key parts when you are writing. So now that we've gathered all of our information, we've done our literature search, now we have all of this. So now we're going to start writing our case report. So the key parts of our case report here are our abstract, and then we're going to do our introduction. The main pieces that we're going to have most of our stuff is going to be the case presentation and the discussion. So when we are writing these two sections, we want to make sure we take into account the care guidelines, which we'll go into here in a little bit. So your case presentation, this is pretty much all of your patient information that you have pulled. The discussion is all of your literature review. So backing up your case The discussion is all of your literature review side, and then your conclusion. What can we do to help? And then you will include your references. Any questions at this time? You can go ahead and unmute yourself.
I had a question about just for us students right now, does a case report have to be written by, the person who's actually seeing the patients, or would it be possible for us to say shadow a clinician or follow a clinician and then write a case report with them or, alongside them kind of thing?
So basically you would do the writing, but this is where I was talking about the steps where you would discuss with a clinician that you are planning on doing this case report. So you want to let your clinician know that you are doing it. And then it might be helpful to pull them into your team. So this is where you'll have that discussion, letting them know that, hey, I'm going to do this case report. And then you pull them in on your team. So that way you have their support and they can kind of help guide you as well with what they're doing for the patient. Does that help answer your question?
Yeah, that makes a lot of sense. Thank you.
You're welcome. Any other questions? All right. I'm going to go ahead and move into the care guidelines next. So care guidelines were developed. So this is just a checklist. So these are really good to keep in mind when you're doing your writing of your case report. So this is just a checklist to make sure you include. These were developed by an international group of experts to support and increase the accuracy, transparency, and usefulness of our case reports. These care guidelines help authors to reduce the risk of bias, increase the transparency, and develop early signs of what works for each patient. So that's why we want to make sure we highlight these when we are writing our case report, especially after our literature review. And we are also looking at our patient information. So like right here in our care guidelines, patient introduction is these bullet points. So 4, 5 are our patients. So when we're doing our care report, if we look back here, our case for presentation, that's where our care guidelines would fall into. So just keep that checklist in mind when you're doing that write-up. So to move into publication, it's our last section of this presentation today. There are many academic journals that focus on a broad range of general medicine topics that you can publish case reports in. When it comes to selecting a journal to publish your case reports, if you want to think about some factors, this includes time to edit decisions, journal reputation, and also the target audience. So those are some of the things that you want to look at when you are doing publishing. Here at AT Stilt, we do have a partnership with BMJ Case Reports. They are pretty much all case report publishing. We do have a partnership with them. So if you want to publish with them, reach out to your library liaison and we can definitely help you and guide you. BMJ was developed purely for publications of case reports, like I mentioned. BMJ is online only journal and it is peer reviewed. So that is there for you guys. And we do provide assistance with getting published in there. Also, here's the guidelines. So they do have some guidelines on how to publish with them. They do lay it out really nicely. So again, if you need assistance, feel free to reach out to your library liaison for help. If you don't want to publish in BMJ, there are 2 other options. Scopus is one of them, and Browsine. Scopus, you can actually go in and do a filter and see the different topics, and you can filter down and see the target audience. You can see all their ratings. Browsine, again, you can also go in and do the search by journal, and you can also do a search by topic in Browsine as well. I do have steps here on Scopus. So again, like I said, you can do a topic search, and you can just put in case reports, analyze, and it will pull up the different journals for you. So there is some screenshots. So you can see BMJ is in there. You can see the documents per year. So it gives you quite a bit of data through Scopus. Browsing is here as well for you. You can do a topic search for case studies. The library does have open access agreements with 3 other publishers outside of BMJ. Our agreements are with Cambridge, Springer, and also Wiley. So we do have this listed on our LibGuide so that you have access to that. We do provide all the different agreement information and what we can provide to help you publish in these journals as well. Any other questions I can help with? If you guys don't have any other questions, I'll give you guys the rest of your afternoon back. Thank you for joining us.
Thank you.
You're welcome.